Good day once again. Dr. Yakubu is my name, Well-Life Hospital Abuja. Today we shall be talking about a viral infection that affects both men and women, particularly adults. And this virus is relatively common. It's called Herpes Simplex Virus. Now, Herpes Simplex Virus, it's an infection that affects people when you have direct contact. In other words, it's a skin-to-skin contact in any form. Now, the virus is common, as I said earlier, and the group of people it affects mostly are adults. The commonest form of transmission, actually, it's through sexual transmission. And there are two types of the virus. There is type 1 and then there is type 2. The type 1, it's the type that commonly manifests as blisters around the mouth or the lips of individuals who have it. And then type 2 is the one that affects the genital area or anal area with blisters, usually painful blisters. Now, this virus, as I said, is transmitted through direct contact. Once you have a direct contact with anybody who has the virus, especially around the time of appearance of those blisters, then you could contact it. So therefore, if someone has the type 1, which affects the mouth or the lips, and you kiss the person, you could contract the virus. Or if it is genital area and there is intercourse around that time, of course, you could also contract the virus. The manifestation is usually in form of blisters, painful blisters. Sadly, the virus does not have a cure once you contract it. However, in most cases, it is opportunistic. In most cases, what it means is that it does not cause any symptoms in any form unless your immune system is engaged or compromised somehow. So therefore, you find out that for most people, the virus manifests either as blisters in the mouth when you have some other disease. Commonly in our environment where we have malaria, we see people coming down with such blisters because they have something else that causes fever, like malaria or even upper respiratory tract infection. The same thing goes with the genital type, the type 2 herpes virus. It usually comes out or manifests when the individual has something else that has engaged or compromised his or her immune system. So the blisters classically last for a few days and then on their own will disappear. The main problem with them is the fact that they're quite painful, almost always, particularly the genital herpes. Is there a cure for it? No. The virus itself never really disappears. It's a lifelong infection. However, the blisters may disappear once your immune system is able to contain it. So by and large, it's an infection that generally is harmless, but it can be painful when it manifests. So people sometimes ask, oh, what's the natural cause of the disease? It doesn't usually cause anything beyond the blisters. But one thing we should know and take home is the fact that it's highly, highly contagious. And once you contract it, it doesn't have a cure, but the blisters can be managed. How to manage them? The viral infection, especially the blisters in the genital area, is there's a cream that can be used, antiviral cream or antiviral tablets when the virus is active that can be used. Sometimes to alleviate pain, we may use painkillers around the same period. Then the other thing that could be done or can be done to also limit the spread and alleviate pain in the course of the disease is what we call sit bath, especially for the genital blisters. Those ones you sit in warm water with plenty of salt in the water, that will reduce the swelling and pain. So by and large, we can manage the blisters, but we have to keep in mind the fact that the virus itself never really disappears. But then it does not cause any other harm to humans beyond the blisters. So thank you very much.